Hi, I'm Dr. Bruce Chalmer. Thanks for stopping by my video today. In part one of this video, we talked about what psychological trauma is and how your brain and body might be affected by it. If you're watching this because you've survived traumatic events and need to heal more than you already have, you know how disturbing and damaging and dispiriting the effects of unhealed trauma can be. You need to know that there's hope, and there is hope. In this part two of the video, I'll talk about how healing from trauma happens, why healing sometimes doesn't happen on its own, and specific techniques you can use, often together with a therapist, to speed the process of healing emotionally, psychologically, and spiritually. So let's talk about how healing happens. As I mentioned in part one, most of the time when we experience some traumatic event, we heal. In other words, after some period of time when we are reminded of the event, consciously or unconsciously, we stay on an even keel emotionally. It's not an emergency. If we're conscious of it, we experience it as a memory, not as a present danger. How does that happen? How do our bodies and minds manage to recover from trauma on their own? After all, isn't that hyper-alert reaction that we develop after a traumatic event an important survival mechanism? How do we manage to unlearn it over time? Well, the key to understanding how we heal is to understand how we learn anything new. Many years ago, the neuroscientist Donald Hebb coined a simple way of describing what goes on in our brains when we learn. Neurons that fire together, wire together. Keep firing the same brain circuits at the same time, and pretty soon they turn into one circuit. All you have to do is trigger one part of it, and the whole thing fires automatically. Look at a toddler learning to walk or a musician practicing a difficult passage, and you'll see this principle in action. At first, a skill starts out as a series of separate parts lurching from one part to another. But after some repetition, it turns into a single coordinated skill. The separate circuits have become one. What fires together, wires together. This happens at an amazing rate in young children, but it also happens to some extent in adults at any age. Turns out you can teach an old dog new tricks. It's what neuroscientists call neuroplasticity. So what has to wire together to heal from a trauma? What circuits do we need to fire together to produce healing? Well, healing is when you can remember the event and still feel safe. So those are the circuits that need to fire together repeatedly. We need to pair the memory of the event with the experience of safety. If you experience the memory and still feel safe, your brain and body will learn that it's safe to experience the memory. That's how we heal. And as I said, usually we do heal. Usually we have enough experience of remembering the trauma and at the same time feeling safe that the two wire together. We learn to feel safe when we remember the trauma. We get those healing experiences all sorts of ways. Maybe we talk about the events with caring friends or loved ones. Notice how that pairs the experience of memory with safety. Or maybe we're just able to calm ourselves when we think of it. Over time, we have enough experiences of remembering the event and simultaneously feeling safe that we're healed. The experience has become a memory. But as we know, sometimes we don't heal from trauma on our own. Why don't we always heal? Why do some traumatic events continue to cause an emergency response, sometimes for decades? Recall what helps us heal and apply the logic in reverse. If we're not able to experience the memory and still feel safe, the memory will continue to produce an emergency response. We'll keep freaking out when the memory is triggered. This is why sometimes talking about an experience doesn't help. If talking about it triggers reactions that are so upsetting that you can't simultaneously feel safe, then talking about it makes it worse, not better. It's what we refer to as re-traumatizing. Another reason why you might not be able to heal on your own is if you can't feel safe at all. If you grew up feeling unsafe or are living in an abusive situation, you might have a hard time feeling safe anytime. And sometimes, even if you can feel safe and can talk about a traumatic event without freaking out, you still might not heal. That's because of another survival mechanism, the ability to dissociate, which means to block some or all of the experience from awareness. Dissociation helps you cope day to day, but leaves the trauma unhealed. It's also why traditional talk therapy is often limited in its effectiveness for healing trauma. If you're essentially talking around the problem, it doesn't do much good. So what can you do? Fortunately, there is help. You can heal from trauma. As researchers have come to understand what's happening when we experience unhealed trauma, new therapeutic approaches have been developed that can provide what you need to heal. I'll tell you briefly about 3 approaches that I'm familiar with and use in my practice: mindfulness meditation, hypnotherapy, and EMDR. What all of these helpful approaches share is that they can provide the conditions we talked about earlier for healing from trauma. They help you feel safe even when the trauma circuits are triggered. Let's see how each of these approaches can help. Mindfulness meditation involves practicing the skill of keeping your mind in the present, often by choosing a particular focus, such as your breath, and gently dismissing the inevitable distracting thoughts as they occur. Like any skill, your ability to do this improves with practice. Being able to focus in the present is a key skill for calming yourself and feeling safe. Hypnotherapy involves learning to deepen your focus so as to have more direct access to your unconscious processes of the mind. With the help of a therapist, hypnotherapy can help you train your body and mind to respond with calm. Again, a key skill for helping you feel safe. Hypnotherapy can also be helpful for working with the effects of dissociation, since hypnosis can facilitate access to dissociated states of the mind. EMDR, which stands for Eye Movement Desensitization and Reprocessing, goes a step further. In addition to helping you strengthen your ability to feel safe, EMDR provides direct experiences of pairing safety with memory of the trauma. As we've discussed, those experiences are just what you need to heal. EMDR can be remarkably efficient in helping process trauma, even when it's been unhealed for a long time. So those are just a few techniques that have proven helpful for healing the effects of trauma. Body-oriented techniques such as yoga, various kinds of therapeutic body work, exercise programs, and medication can all help as part of the process of healing. Of course, any therapeutic approach is valuable only to the extent that you are willing and able to make use of it. Ultimately, to be willing to reach out for help is an act of great faith and great courage. You can't know for sure if it will help, or if you can tolerate what it takes to heal until you actually experience it. Healing requires faith. And when you're reeling from the effects of trauma, faith can be in short supply. So I want to leave you with a vision of faith. Faith is when you know simultaneously, to paraphrase a Hasidic rabbi, that on the one hand you are but dust and ashes, and on the other hand, the universe was created for your sake. Faith is when you suffer deeply and can still be aware of the fundamental rightness of reality, not because your suffering is good, but because you know you are vitally a part of the universe, even in the midst of suffering. Faith is what will give your suffering meaning and help you heal. Faith is what will let you reach out for help. Eventually, faith is what will let you forgive. Forgive your own mistakes, forgive those who have hurt you, and even forgive God if you need to. But that's a subject for another video. I'm Dr. Bruce Chalmer. Thanks for visiting.